my name is Scott Hookinson from Brabo Benefits, and I'm here with Kevin Hennessy from Brabo Payroll, and today we're going to discuss 1095C reporting.
So this is definitely a challenge for all of our clients, and a lot of people ask us all the time, am I an applicable large employer? So today what we want to talk about are some of the guidelines around 1094 and 1095C reporting, and where we might be able to fit in and help you out a little bit with the process.
Okay, so what is 1095C reporting? This is a 1095C. This is a report that must be sent to every employee of an applicable large employer every year, and this year the deadline is on March 4th, 2019. Why do we have to send out a 1095C? Because the Affordable Care Act requires us to do so. When do we have to do it? It has to be filed or sent to each employee by March 2nd. And who has to send it? That's what we're going to spend some time talking about.
Right.
Because who is really the most complicated question during this process. Every applicable large employer is every employer that has over 50 full-time equivalents. A full-time equivalent is not a full-time employee.
Right, so the way that we look at this is going to be a measure of full-time employees, which the IRS currently defines as employees that are working on average over 30 hours a week. So any of those people that you have as that are viewed as a full-time employee, you put them under one list. And then what you need to do is you need to look at all of your part-time staff. You need to add up all of their hours. And I'm actually going to show you this cool online tool right now. Take a look at this. This is a great tool to help you figure out how you can see whether you're an applicable large employer or you just have a lot of people hanging out. And now I want to show you the healthcare.gov calculator, which is available at healthcare.gov/shop-calculators-FTE. The FTE stands for full-time equivalents. This calculator is going to help you figure out how many of your employees will count towards you being an applicable large employer. Now, the first thing it's going to ask us to do is enter the number of full-time employees. So let's say that we are a seasonal restaurant or a restaurant that has 35 employees that are all full-time. And let's say that we have 29, well, let's say we have just as many part-timers, 37. All right. Now, one of the things that we've discussed is that you want to look at this over a monthly view to get a better average. And what you'll do here is you're going to add in each of your employees and how many hours that they worked for the time period that you selected. So we recommend doing a monthly view, and Kevin H, say, worked for 90 hours. Then you're going to add another employee, which we'll do Scott H. And we'll say he did 120. And remember,
30. See what it says.
Oh, let's see that. So to Scott's point, if we do 130, the calculator hopefully will stop us. Oop! Part-time hours are limited to 120 hours, which is excellent because we've already counted all of our full-time employees, anybody that's working over 30 hours on a regular basis under the full-time number. So each part-timer can only count as one full-timer at a maximum. So anything over 120 hours will not be included. But I just wanted to show you this very helpful tool that you can use to help establish whether or not you are an applicable large employer.
Okay, now we're going to determine whether or not you are an applicable large employer. Okay, if you are an employer, you have to file these 1095Cs. If you are not, you do not have to do that. So let's root that you're not. But if you are an applicable large employer, then you have to file 1095Cs before March 4th of 2019. What we're going to do is we're going to take your total number of full-time employees. Your full-time employees, according to this calculation, is anybody working over 30 hours. You might have in your handbook a full-time employee is somebody who works over 37 hours or 40 hours, or you have managers that you require to work 60 hours. For this calculation, it's anybody who works consistently for you over 30 hours a week. So let's say you have 35 of those people. Now we have our part-timers. We're going to take a pool of your part-time hours and divide that by 120 hours per month. So you have to go into your payroll reporting or to however you calculate your part-time hours and come up with a pool of part-time hours. So let's say you have 120 part-time hours this month. Okay? That equals one part-time employee. But let's say you have 12,000 part-time employees, or part-time hours that you've accrued that month. then you're going to have 1,000 part-time employees that you add to this calculation. So it's very important that you determine whether or not you have enough part-time hours to put you over the top. If your full-timers exceeds 50, you have to do it. If your full-timers are below 50, then you have to look at your part-time hours, divide it by 120 over the course of the month, and that gets you your total calculation. Now, we live on the coast and we have a lot of seasonal employers. So there is a seasonal employee exception. If you have a seasonal employee who works less than 120 days for you, so for our retailers that have stock up in the Christmas, and they have a lot of people, or you have the delivery companies that stock up in the Christmas, those people aren't working more than 120 days. At best, they're working 60, maybe 90 days. But for our landscapers, they might call them seasonal, but they work from April until October. April to October is not seasonal according to us. You have to add those part-time hours into the big pool. But let's say you're a restaurant in Plymouth and you employ people from June, July, and August. There's 90 days there. You can probably exclude those hours on this calculation. This is not legal advice. You have to talk to your attorney, talk to your accountant. But the exception is real, and the exception says anybody less than 120 days can be excluded from the calculation. So it's very important to know what your workout is. Call us, we'll help you figure it out and tell you who is likely to be included. Hello again, we're going to continue discussing applicable large employers. Are you an applicable large employer? You've done the calculation, and all your calculations show you're less than 50 employees. However, you are a laundromat, and you have 6 locations with 6 different tax ID numbers, and all 6 of those locations were less than 50 employees. But you have common ownership, and you do the same thing. I'm sorry, we're going to bump the 6 of you together. So you're going to take all 6 of those calculations and add them all together. And that's your full-time number. So if you have multiple tax ID numbers doing the same thing, you have restaurants, but you break them up. You have laundromats, you break them up. Or however, you're a real estate agency, you break them up. However you do that, you're still going to take your full-time employees plus your part-time hours divided by 120 per month, and you're going to add them all together and come up with your number. We do a lot of business for a large retail location here, company here in Massachusetts. We have a lot of different tax ID numbers that we report this under, but the requirement is done because collectively they're over 50, and even though independently they were not.
So it's time to talk penalties, and there are definitely real numbers now that they're imposing for not complying with the Affordable Care Act. So the reference for this law is 4980, capital H, lowercase a. So 4980 HA. And the way that they establish the penalties is, let's use a 100 employee company as an example. So we'll start off with 100 employees. Every company is actually going to get a 30 employee exemption. So minus 30 employees, okay, is going to have 70 employees that they must pay the penalty on. The penalty today for non-compliance is $2,320 per employee. All right, Raymond, $162,000 for this example, okay? What else is very interesting, even though the penalty was $2,320 here, this is assuming that you didn't know that you couldn't do that. If you flagrantly disobey this law and you choose that the penalty is a better decision than providing credible coverage, then they actually will double this penalty. So very, very seriously, it goes from $2,300 to $4,640 per person, which is going to be double this, which I can tell you is about $324. $4,000. You know, I mean, this is in a place that's already struggling to find a way to pay a high wage. Knocking $324,000 out of their budget is certainly not going to be a good thing for the company. So again, these penalties are big. They're taking this very seriously. The Affordable Care Act is still in act, regardless of who is leading the country. So this never went away. A lot of people have not filed this, have not addressed it, and we are starting to get a lot of clients that have letters from the IRS demanding fines. So please take a look at doing 1094 and 1095C in 2018 if you are an applicable large employer.
Whether or not the plan you offered in 2018 was affordable to the employees. One of the things that the 1095C records is whether or not the plan you offered to the employees was affordable. Here's how the ACA determines that. We're going to take last year's minimum wage of $11 an hour. So let's say you hire somebody and you offer them minimum wage and they're working 30 hours per week. We can't require any more hours. The ACA requires 30 hours. So for this calculation, I'm only going to use 30. 11 times 30, that means the employee is making $330 per week. What the ACA says is that as long as what we charge them for health insurance is less than 9.5% of their income, then the plan's affordable. So 330 times 0.095, we should be charging our lowest income employees $31.35 per week for the health plan. You multiply it by 52, divided by 12, we get this number of $135.85. For all of my employers that have employees that are full-time making minimum wage, that's the most we can have them charge the employees to have the plan be deemed affordable in 2018. In 2019, the number goes up to $12 and you do the calculation all over again. But this was the maximum amount. So this is the amount that has to go on for every month that that employee was eligible for health insurance. It's very important to note, you do not have to report whether the employee took the health insurance. You're just reporting when you offered it to them. So let's say your open enrollment is in October and they worked for you for all 12 months. You offered them an affordable plan for all 12 months. Okay? Whether they took it or not is not what this plan is capturing. All this plan is capturing, all this report is capturing, is whether or not you offered them affordable coverage. It is your requirement to provide the employee to show, yes, they were offered affordable health care during 2018, and here were the months that they were offered that health care. That's what has to go on to your 1095C. We've talked about what the 1095C is and who has to file it, but now we're going to talk about why. The IRS, if you don't file this, has a few penalties that they'll impose upon every applicable large employer for a couple different reasons. If you don't offer an affordable plan that has minimal credible coverage, means the plan has to offer good coverage, then you're going to get a penalty of, forgive me for checking my notes, $2,320 per employee, less the first 30 employees. So you get a 30 employee mulligan, but let's say you have 100 employees, you're going to get $2,320 times 70. It's about $160,000 penalty that you're going to be hit with for not doing this report on time. If you don't do it intentionally, if you say, you know what, doing the penalty is cheaper than offering health insurance, then they double the penalty. So they're smart and they figured that out. That people said, oh, penalties are cheaper than health insurance, so we're just going to intentionally ignore everything in the meantime. The IRS has gotten much better too at collecting this data, knowing how to find the data, and they've hired new agents to track down employers. We've had employers get these notices, but we've then been able to prove that they were offering a qualified health plan during that time. Sometimes you check off the wrong box, your accountant checks off the wrong box, it could trigger one of these penalties. It's very important to consult a professional benefits analyst that can look at your plan, look at what you're charging employees, and make sure that you're not responsible for these penalties. These penalties are real, they are collecting them, they're budgeting for them, and it is our job collectively, our job being you, the employer, and us, your benefits partner, payroll partner, to make sure that we avoid those penalties together. The penalties are always triggered when you have an employee. It could be just one employee who goes on to the exchange. In Massachusetts, we call the exchange the Massachusetts Connector, and they get a subsidy from the Fed to help them pay for health insurance. It's those people that they then cross-reference their tax returns and say, wait a minute, they worked for this applicable large employer, why didn't they get health insurance there? And that's when they do their homework, they do their research, and find out that you didn't offer them an affordable plan, and they come hitting you with the fines. Once again, I hope this has helped you understand what a 1095C is, who has to file it, when it's due, and why we're recommending you file yours before March 4th of 2019. Thank you very much.
Thank you.